Roadhouse, and just want to introduce you. Why don't you go ahead and say your name for everybody? And
Pam Rampley.
okay, so Pam is brand new in our program, and basically what we want to do is just kind of tell everybody the symptoms that you're having. You know, obviously you're here because all the other doctors couldn't help you. But how many doctors have you been to?
I've been to so many I can't even count, at least 20 or more. Been to
Okay.
chiropractors and just everybody I can think of I've been to.
Okay, so you've tried everything and no improvement. As a matter of fact, you're getting worse, right?
Yes,
Yeah.
yes.
Okay, so why don't you talk about the things that are really bothering you the most? We'll kind of talk about this last weekend because that was a pretty good representation of how you've been feeling.
I'm just in a lot of pain. My whole body is in pain. When my husband comes in the morning and says, "How are you?" I say, "Well, my little finger doesn't hurt." But everything in my whole body hurts all the time. I can't. The only way I could get any relief this weekend was to lay on my side, and then I could get some relief. But it's just getting worse and worse.
Okay, so the relief that you're talking about, you didn't get relief, but it took it from like a 12
yes.
down to like a 9 where
Right.
it was bearable. Right?
Yeah.
Okay, so other than overall the pain, what else are you experiencing?
Swelling, terrible
Okay.
swelling in my
Can you show
hands.
your hands?
My hands.
Look at her hands right here. I mean, look how swollen, and they are puffy and swollen. And
My hands
just,
and my feet, my whole body is
her whole
just
body,
swollen.
her feet are really
My
swollen.
ankles.
Your ankles.
Mhm.
Okay. What about like headaches or anything like
I
that?
had a migraine yesterday,
Okay.
and I have those pretty regularly.
Okay. When you get those, any change in light? I mean, does the
Yes,
light bother?
yes,
What
light
about sound?
and sound.
So she's got both. I mean, the brain either is going to be visual or auditory, and you have both of those.
Right.
So that's probably why, they've been difficult to deal with. Okay, so what about stomach trouble?
I'm constantly nauseated.
Okay.
Constantly. It's not bad, not enough that I think I'm going to throw up,
Mm-hmm.
but it's just constantly there right now. I'm just nauseous. I'm always nauseous.
Okay. Reflux, anything like that?
I have reflux.
Okay. All right. You've tried,
I take
obviously,
medication for it.
and it's still doing it. Okay.
Yes.
What about the colon and stuff like that?
Yeah, I just have trouble with everything. Everything is just torn up. It's just like my whole body doesn't work. And when I try to walk, and I've said this from the beginning, when I first started having problems before all of my surgeries, when I would stand up and try to take a step, it was like my brain and my feet were not connected. My brain wasn't telling my feet what to do, and I couldn't make them make a step. I'd have to stand there and really think and say, "Okay, feet, let's go."
Okay.
And so,
yeah, and that's the neurological part of the program. I mean, that's what we talked about quite a bit. When we did the neurological exam on you, we found several things. They're soft lesions, but that's what we're going to be working on too, along with the metabolic. What about your sleep? How you doing with sleep?
well, like when I use my CPAP, which I use every night, I do pretty well.
Okay.
Yeah.
And
without it, I'm awake a lot.
okay, all right. And what about balance?
Oh, my balance is terrible.
Okay, all right. Memory?
It's non-existent.
Okay, so pretty much, not much is really working right now.
No.
Is it? Yeah.
No, nothing's
You
working
gained
right.
a lot of weight,
Yes.
a lot of swelling. What about any hair loss or anything like
Just
that?
a little bit, not bad now. It kind of goes in spurts. I'll have a lot of hair loss and then I won't have any for a while. It just kind of, but not right
You're
now.
losing that outer third of your eyebrow too. So yeah, okay. All right. Any anxiety or depression? You get heart palpitations?
I do when I try to walk very far. I will, and I get just tired so fast, and my heart is just going really fast.
And your energy level is
It's
real
just
bad, isn't it?
yeah. I just don't have much energy at all.
So what is your daily activities like? I mean, what do you do around the house?
Very little.
Okay,
very
so you're
little.
pretty much sedentary,
Yeah,
right?
I know.
And you walk with a...
At home, I don't use my walker.
Okay.
I'm a furniture walker.
Okay, so you're using, but you
yes.
still use support, but
Yes.
you're not using that. That's
Right.
for when you get out because you get so fatigued
Yes,
and tired
yes.
and stuff like that. Okay. Well, I mean, we could go on and on, but I mean,
Right.
bottom line is nothing's really working right.
Mhm.
You're not doing really good, and we just wanted to get a video, so because like I told you, most of our patients after they get done, they have amnesia when it comes to this
Mhm,
because
mhm.
I mean, it's just
Right.
so bad,
Right.
And then and then this last weekend, I
Mhm.
mean, you just started, and you had a treatment last
Mhm.
week, and then this is your
Mhm.
first treatment now and stuff. But um, how long have you been putting up with the overall, just the pain that you have? Because you've had several surgeries, you're still in
Right.
all kinds of trouble.
Right. The really bad pain has been going on for at least 8 years.
8?
At least
Okay.
8 years.
Okay. So anyway, I'm sorry you're going through all that, but when we did the evaluation, you had all the markers, all the parameters. We talked about your commitment level. I told you it's not
Right.
going to be easy,
Mhm.
but we're waiting for the labs to come back. So we're just doing the neurological treatment on her now. After we get done here, we're going to test her for the colored glasses to see if we can slow down her upper brainstem from overfiring, so we can reduce some of the inflammation that's causing all the
Mhm.
swelling and the pain. And then we'll check in with you in probably a couple months because we need to get all the labs back. We need to get started on that. So in 2 to 3 months, we'll check back in with you, and we should see
Okay.
very good improvement.
I
Okay?
hope so. I'm
Thanks for
ready.
thanks for doing this.
Mhm.